Hello everyone, in this lecture I am going to take very important uterotonic ecbolic drug, that is Methergine. So it is a semi-synthetic drug. It means this drug is prepared in the lab, but the substances that we use comes from nature. So it is purely a ergot alkaloid. It means this contains some nitrogenous compound that derive from a fungus. The fungus is Claviceps purpura. So from that fungus we take out some substances and prepare lysergic acid in lab, and from that, by using that lysergic acid as a precursor, we prepare Methergine. So this fungus basically develops on some cereals like on rice or some wheat. So from that fungus, the ergot, we take some substances and prepare. So that's why it is a semi-synthetic component, and it is available in Methylergonovine or Methylergometrine form, and it is a very strong uterotonic drug. It strengthens the uterine tone, and it is quite different from the oxytocin, where oxytocin help in uterine contraction, but the contractions are in a rhythmic pattern. The one time they become contract and one time they become relaxed, and once the upper segment, the fundus part, become more contracted, at the same time the cervical and the lower segment part become more relaxed. But the Methergine causes tetanic uterine contraction and makes this uterus in a state of a spasm where there is no relaxation in between the contraction. So this is quite different with the oxytocin, where some relaxation are also there, but here there is no state of relaxation. The uterus remain in a state of spasm. It continuously contracts, and even the whole part of the uterus also involves. Here there is no relaxation of lower segment. The uterus equally contract from every side. So from upper and lower segment as well, it will contract very vigorously. So thereby it is quite different with the oxytocin. And along with that, it has also vasoconstrictive activity as well, because it causes the constriction of smooth muscle that lines the vessels. Now, in what all condition we can use this medicine? So, following the delivery, once the baby delivers out, or following the procedure of abortion, or once the hereditary form mole, the vesicular moles, that is the vesicles, the grape-like vesicles being evacuated from the uterus, after that the torn blood vessels remain open, and that may cause heavy bleeding. So to stop these vessels from bleed and to make them contract, we can use this Methergine. So thereby the torn vessels can be obliterated by the contraction of uterine muscle, and the blood bleeding can be controlled. So it can be given in such condition. And if the woman land up in PPH, postpartum hemorrhage, where the cause behind that is atonicity, where the tone of uterus is lost. So to establish that tone, to make the uterus more contract, we can administer this drug. And in similar manner, in subinvolution of the uterus also we can administer, because when the involution is retarded, involution means where the uterus revert back to its pre-pregnant state by contracting these muscle fibers. So suppose if the uterus is not contracting well and is not able to revert back from pre-pregnant state, the involution is retarded. In such condition, that is in subinvolution, we can administer this drug. Now, in which all condition we cannot use this drug? What are the contraindications? Suppose if the woman had the history of heart diseases, any type of heart disease, any type of hypertensive disorders, or preeclampsia, eclampsia, in such all condition we cannot administer this drug. Because if the woman already had some vascular disease, in such, if the uterus get contracted very spasmodically, there the blood which is present in the placental bed can sweep back into the maternal systemic circulation and increases the load in the heart. So thereby in some condition the heart failure may be there. So we cannot administer this drug in such condition. And if the pregnancy is of multiple gestation, then also once the first baby delivers out, we cannot administer because one is still remain inside the cavity. So if we accidentally administer this drug, then what happened? The uterus get contract in every direction and thereby the second baby gets stuck into the cavity, and that can be compromised by the blood flow, and even though death can be happen. So we cannot administer once the multiple pregnancy is detected. And if the mother is Rh negative, then also we can't administer because there may be a chance of feto-maternal bleed once the uterus get contract. So the blood from the fetal circulation can enter into the maternal circulation and make the mother more sensitized with this Rh factor, and thereby mother can form antibodies against the other subsequent pregnancy. So to stop this sensitization, we cannot administer Methergine at the time of delivery if the mother is Rh negative. And if there is hypersensitivity of this drug, then also we cannot administer this drug. And in the condition like induction and augmentation of labor, where we want to initiate the uterine contraction or we want to accelerate the uterine contraction to deliver out the baby, then also we cannot administer because the contractions are in all directions. And if we administer this drug while the fetus lies inside the cavity, then the fetus can stuck inside the cavity and cannot be delivered out. So in induction or in augmentation, we cannot administer this drug. Now next are the routes and dosages of drug. So this drug can be administered through oral, IM and IV route, and basically it is available in ampoule and tablet form. In ampoule, it contains 1 ml contains 0.025 to 0.5 milligram, and in tablet form also it is available in 0.2 milligram. So through orally it will work very slowly. It takes 10 minutes to react, and intramuscularly it works more faster, that is within 7 minutes it will react. And intravenously, once we inject directly into the blood vessels, then it reacts immediately within few minutes, that is from 1 to 1.5 minutes. From 45 seconds to 90 seconds it works. And the half-life of this drug is 2 hours, that is after 2 hours the drug remains half to its original value, and the duration of this drug is around 3 hours. So once we administer this drug to mother, it works around 3 hours. So after that we can repeat it. Now next is the side effects. What all bad impact the woman may have with this administration. So the mother may have nausea, vomiting, diarrhea with its use, and sometime because of its vasoconstrictive effect, the mother have hypertensive disorders, hypertension, and even the blood flow will be that much disturbed that it cannot reach up to the vital organ like brain. So it can lead into the stroke. Even if the blood is not reached up to the lower limbs, then also sometime it can cause gangrene of toe, where the blood flow will be very much diminished and it will not supply to the distal part of the toe, and that may cause the cell death and the cell become blackish in appearance. So gangrene of toe may be rarely seen with this use, and as this drug causes the prolactin level to be low, so lactation failure would be there. Even it may cause headache, dizziness and hallucinations in some mother. So these are the side effects of this drug. And the last is the nursing intervention. It means what are the responsibility of a nurse while she administers this drug. So as this drug causes tetanic uterine contraction, it maintains the uterine tone. So we have to check the uterine tonicity, how much the uterus is contracted, how much intense the contractions are, is there any relaxation phase between. So we can check the tonicity of the uterus. Thereby we can assess the amount of bleeding, vaginal bleeding, because once the uterus tone is well established, then the bleeding would be controlled. Thereby we are assessing the vaginal bleeding as well, because once the tonicity of uterus is established, the bleeding would be less. As the uterus get contract very severely, then the toned blood vessels will be occluded and the blood loss will be minimal. So simultaneously we check the bleeding per vaginally also, is it controlled or not, and as it has got vasoconstrictive effect, so thereby we can check the vitals regularly. So we can monitor the blood pressure of mother as well, whether it is fluctuating more or not. So as in side effects, some abdominal cramps and pain also would be there. So we can assess how much intense this pain are. So these are some intervention that we can follow while we are administering this drug. So here in this lecture, we have discussed with this drug, that is Ergot Alkaloid, that is derived from the fungus, and we prepared it in lab. And we have seen its action, indications, contraindication, routes and dosages, and side effects are the interventions. Thank you.